Mental health, stress, and trauma amongst Asian immigrant origin youth. Mental health in Asian communities. In Asian immigrant origin youth, that is, Asian American students or adolescents, where do mental health issues primarily stem from? Mental health issues primarily stem from Asian immigrant parents. Asian immigrant parents are more prone to suffer from mental and physical health problems. They often lack a network for support. They often lack job stability or job comfortability. Oftentimes, they're working paycheck to paycheck just to make ends meet. And the stress from these factors indirectly spreads to stress in their children. So, what are some of these sources of stress that the children face? Boston University's School of Social Work Associate Professor and Chair of Social Research, Dr. Hyuk Chris Han, brings up her own points on the hardship experienced by children of immigrants. Throughout her article, More Hardships Experienced by Children of Immigrants Than by First Generation, she notes the different stressors, or as she calls them, traps that Asian American adolescents face, which ultimately contribute to higher rates of mental illness. Moreover, I want to specifically note two of the traps, the inner voice trap and the family trap, as they are prime examples of generational trauma that exists within Asian families and is typically passed down from the immigrant parents. The inner voice trap is where Asian American students struggle with meeting high expectations and performing well. Regardless of how successful they may be, this is typically ingrained into Asian American students at a young age. They have pressure not only from their Asian immigrant parents, but also from themselves to succeed and many times overachieve so as not to waste their opportunities in life. They strive for perfection at all times, which is obviously very unhealthy. And the family trap is very similar to the inner voice trap. The family trap is where children are burdened to meet and fulfill all the expectations that their parents place on them. Asian immigrant parents constantly remind their children that they should strive for excellence, meet their standards, and become successful. This adds even more pressure and burden to a child, especially since most of this occurs during that child's upbringing. Simply put, mental health in many Asian cultures is almost completely shunned upon. Asian immigrants rarely communicate with their Asian American children about their thoughts and feelings, which makes it hard for them growing up to express themselves. Asian immigrant parents justify their strictness and harshness by reasoning that they only want the best for their children. They believe that this reasoning justifies the mental health problems and stress they indirectly give to their children. This obviously causes a lot of trauma as the children learn to suppress their thoughts, feelings, and frustrations with their parents. There are stigmas and perceptions of mental health persistent in Asian American communities that have created a reluctance for Asian Americans to look towards mental health services for help. Many Asian American children learn to keep things to themselves rather than express their discomfort. This is their method, however unhealthy it is, of dealing with the many stressors they experience. In their article, Sources of Stress and Barriers to Mental Health Service Use Among Asian Immigrant Origin Youth, Aurora and Ku talk about mental health services and how Asian immigrant origin youth, we'll call them IOIs, are directly affected by their lack of mental health help. Aurora and Ku describe a relevant study of Asian IOIs and the role that family plays in Asian IOIs' mental health literacy. Second generation Chinese American youth were queried about their perception of school health programs. Results of focus groups revealed that second generation Chinese American youth associated the use of school health programs for only high needs youth, those engaged in drug use, and had high stigma toward regular service users in their schools. As they are taught from a younger age to not rely on or look at mental health services, Asian IOIs have the complete wrong idea of what mental health services are even there for. Since it is so looked down upon by Asian parents and elders, Asian IOIs are practically brainwashed into believing mental health services are only there for issues like drug use, but not the plethora of mental health issues they experience, like depression, anxiety, feelings of burden, etc. Thank you.